Study of effectiveness of Chitosan in the process of wound bleeding on Wistar at Hedenoviana is Winarnodo Saputra and Linda Haryani. Abstract: the general way to treat bleeding using topical epinephrine has been widely used, but if there are large capillaries, the effectiveness of epinephrine still needs to be improved, and bleeding still occurs. Research to find methods or devices that successfully create hemostasis could to contribute significant reduction in bleeding-related. Chitosan-based agents have shown great promise in preventing major bleeding in the pre-hospital setting and in animal model of excessive blood loss. This study aimed to improve the effectiveness of Chitosan in treating bleeding compared to epinephrine 1 and 100,000. The objective of this research was to knowing the difference in the effectiveness of giving Chitosan compared to epinephrine 1 to 100,000 in stopping bleeding. This research used an experimental research design, a randomized post-test only group design. The subject in this study were mice treated with wound measuring 3 by 3 centimeter on their backs with a full thickness depth plus minus 1.3 millimeter. A total of 36 consecutive subjects were randomly grouped into treatment groups, namely the group given epinephrine and the group given Chitosan. The coagulation time in the bleeding wounds of rats in groups 1 and 2 was immediately calculated with a stopwatch after topical epinephrine and Chitosan were administered. Then coagulation was evaluated after 3 minutes. Results: there was a significant difference in the time needed to stop bleeding between the epinephrine and Chitosan groups, where the time needed to stop bleeding in the epinephrine groups was higher than the Chitosan group. Conclusion: Chitosan provides a faster cessation of bleeding compared to the use of epinephrine in experimental mice with acute wounds. Keyword: bleeding, epinephrine, Chitosan. Thank you.